So, Phyllis, you're here today. How many weeks after your Achilles tendon surgery?
It was November, I think the 14th.
Okay, so you're 2 months.
2 months.
Today.
Yes.
And you flew from Europe to
Yes.
have it done.
Yes, yes.
So that's why I thought it was a very interesting testimony, because I did your other surgery many years ago, right?
Yes.
And it was an honor for me to have you fly here, because obviously there is a good trust thing going on between
There
us,
is.
because we've been through this before.
Yes.
And when I told you that you have Achilles tendonitis, and I told you that this is a very complex situation because we cannot really inject cortisone in the tendon, so there are very limited non-surgical options that we have. And we have still tried them, right? Because
Yes.
we were like very optimistic. We're like, let's try it. Only if it doesn't work, then plan B.
Right.
Well, and our plan B was a wonderful plan B, because as I told you before, plan B 3 years ago was an open surgery where I would go in, I would take the tendon off the bone, I would, clean out the bone spur, reattach it back with 2 bone anchors, which was very invasive surgery, and it's probably one of the longest surgeries recuperation wise, because you're like off your foot for 4 weeks and a boot for additional, and who knows how long, and it really took about 6 months for people to stop limping. So when I saw you, I'm like, okay, we have this new surgery, it's phenomenal, let's do it. And I know that the reason why I'm doing your testimony is because you had a very severe case of Achilles tendonitis. And it took a little bit longer than 6 weeks. It took 8 weeks.
Yes.
But how much better are you today comparison to where you were when we first met?
Oh, unbelievably better. I mean, I couldn't take one step without pain. And it was just ongoing all the time.
All the time.
Everywhere I went.
Right.
And now, no pain other than if I overdo and do more than I should. And that's just going to take some time for me to, for it all to heal completely. But it's unbelievably better.
Good, good.
I'm so thankful for
Oh,
what
good.
you did, the procedures.
Well, we really turned the corner in the past couple of weeks, and I think really is, well, because you were also a little bit unlucky with physical therapy.
Yes.
And I think that kind of set us back a couple of weeks for sure. But you're leaving to go back to Europe, so have a great trip.
Thank you.
And call me if you have any problems, okay?
I sure will.
All right.
Thank you, Dr.
Sure,
Wellens.
sure, my pleasure.